Hey everybody. So today's video blog is going to be on the topic of middle ear problems and the spectrum from normal to full-blown ear infection in the middle ear. So just to review, the middle ear is the space behind the eardrum on the inside of the ear. And normally this space should be full of air, and that air should be the same pressure as the air outside in the world. There is a connection to that middle ear space that connects into the back of the nose on the inside, and that's called the eustachian tube. So if you've ever been on an airplane and you kind of feel that air pressure change, and then you yawn or swallow and your ears pop open, that's that eustachian tube opening and the pressure equalizing between your middle ear space and the outside world. So obviously people can get problems with their middle ear. So if we go on one side, we call this completely normal, and on the other side, we call this full-blown middle ear infection. There's sort of a spectrum in between there of various waypoints where we go from completely normal to slightly more severe problems to more severe to full-blown infection. And when I treat patients for middle ear infections, there's sort of a gradual progression back down that spectrum until patients are back to normal again. So sometimes people, it's like flicking a light switch from infection back to normal, but most of the time it's more of a gradual process with a few different stopping points along the way. So if we kind of go through our progression here, so normal is obviously people feel normal. Their ears feel open, they hear fine, there's no pain, there's no problem. If we go all the way to the other end, full-blown middle ear infection, there's lots of pain in the ears. That's kind of the hallmark of that worst possible point. But there's also muffled hearing, there's a lot of pressure and fullness in the ear, but the real thing that distinguishes the infection is the pain aspect. So if we move kind of in between those two extremes, the next step down from full-blown ear infection would be fluid buildup behind the eardrum, but no infection. And normally with this, a lot of the pain aspect has been removed. Sometimes it's still uncomfortable and it can be painful at times, but mostly people just say their ear feels really plugged up. They can't hear very well. It's like they have a wad of cotton in the ear. So that's kind of, it would also be considered otitis media, but it's not an infectious otitis media. It's just fluid behind the eardrum. As we improve from that towards normal, there's a sort of a next step as well. And this is where there's no fluid behind the eardrum, but the air pressure is off. And usually what happens is the air pressure is actually negative compared to the pressure out in the world. So that creates sort of a vacuum type situation behind the eardrum. So when I look in someone's ear, sometimes we're able to see the eardrum look sucked inward. And when I test the pressure, we see that there's that negative pressure behind the eardrum. And this would be what would happen probably if you went on an airplane and your ear is temporarily clogged up. If we were to measure your ear at that point, we would probably see negative pressure behind the eardrum. And then when it pops, obviously it's going to be equal to the outside air pressure again. So that's kind of the main four areas along the spectrum. We have normal ear on this end, we go to negative pressure, no fluid, then we go to fluid behind the eardrum but not infected, and finally, all the way on this end, we have a full-blown middle ear infection. So there's that spectrum of kind of going up and down that a lot of people need to follow along until they get back to normal after these types of ear infections. So, if you do have a middle ear infection, don't necessarily expect it's going to get magically better overnight. It's usually more of a several day to even sometimes several week process to get back to normal. So I hope that information is helpful and you learned a little something today. And I'll talk to you on the next video.